Call the meeting to order. Please stand for the pledge. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call.
Ms. Elchow?
Here.
Mr. Lindemann?
Here.
Dr. Gomez?
Here.
Mr. Ramos?
Here.
Mr. Bering?
Here. Do we have any public comments that don't have anything to do with the item that we're going to expressly discuss?
No, sir.
None. Okay, so we're going to save all of the ones regarding that when we get to the issue. And what we'll do is we'll hear from all the public comments that is regarding the issue at hand, and then the board will deliberate. Okay? Mm-hmm. All right. So we'll go right to the public comments. But before we do, I want to make sure that for just general knowledge and information that everybody is well informed about exactly what we're going to be doing here today. So I'm going to have Anna, if please read what we're going to actually be discussing specifically today and what the resolution says, because if we decide to go with it, it's a resolution, and exactly what the language is in the resolution, and what the options are at the end. Okay. So if you do that.
And if you allow me to, before we get into that, I just want to take a moment to recognize and give our condolences to our Sarah Marley staff and family, the Mendez Barraza family, who lost two of their students to a very tragic accident a couple days ago. And so a moment of silence for Asira Naideli Mendez, a pre-K student, and Nomelia Dilene Mendez, a first grade student at Sarah Marley.
Okay, so we'll have a moment of silence. Thank you, and thank you for bringing that to the attention of the board. Okay, go ahead and give us that information so that we're well informed about
Okay.
what, and the public is as well.
Okay. So on Monday, August the 17th, the Arizona Superior Court ruling established that the no mask mandate law cannot take into effect until the 29th of September, despite the language in the law which stated that it was retroactive to July 1st. So based on that, our attorney has drafted a resolution which I will read to you. And under this resolution, it would be a recommendation to implement the mask mandate for staff and students while indoors from now or from tomorrow until September 28th, which is when the law would go into effect on September 29th. So the resolution says, require mask when indoors on school property. Whereas the COVID-19 pandemic has not abated in our community and instead cases continue to rise. Whereas the CDC, the Arizona Department of Health Services, the Arizona Department of Education, and Cochise County Health Department of Health Services are advising that all persons wear masks indoors because of the new evidence about the spread of the Delta variant of COVID-19. Whereas the Arizona Department of Health Services lists the universal and correct use of masks as one of 5 key mitigation strategies that schools should use to prevent the spread of COVID-19. Whereas the governing board has the authority to establish policies and procedures for the district that help to ensure student and staff safety. Whereas the Arizona Constitution provides that any legislation passed by the legislature does not become effective and is not the law until 90 days after the close of legislative session, which is September 29th, 2021 for House Bill 2898. Whereas the Arizona Constitution permits the legislature to make a law effective retroactively only if the certain criteria are met and the act is approved by the affirmative vote of 2/3 of the members elected to each house of the legislature. Whereas House Bill 2898, which includes a new law, ARS 15-342.05, was not approved by the affirmative vote of 2/3 of the members elected to the State House and Senate. And whereas there is a good cause to believe that ARS 15-342.05 is not currently the law and it will not become effective until September 29th, 2021. Now, therefore, be it resolved by the Governing Board of Douglas Unified School District Number 27 of Cochise County Arizona, that the governing board authorizes the superintendent to include in the district's COVID-19 school mitigation plan the requirement that all person wear a face mask while indoors on school property, subject to exceptions established by the CDC, Arizona Department of Health Services, or Cochise County Department of Health. Work with relevant governmental authorities to comply with all applicable laws, regulations, orders, and guidelines designed to prevent the spread of COVID, and that the superintendent implement regulations or protocols to support such compliance. The superintendent conform the district's mitigation plan to comply with the provisions of ARS 15-342.05 if a court of component jurisdiction determine that ARS 15-342.05 is currently in effect or in effect prior to September 29th. Inform the board on a regular basis concerning the steps being taken to prevent the spread of COVID. This resolution, if adopted, properly noticed on today's meeting, and then the governing board hereby authorizes the governing board president to sign the resolution on behalf of the governing board.
Okay, and that resolution came from the trust attorney?
Attorney, yes.
Right, and is that the generic one that all school districts are using?
Yes.
Across the state? Okay, we'll go to, and we did that just so that we all know what we're going to specifically be discussing, and also for anybody in the audience that's going to address the board. And we do have an individual, Mark Wilkinson, and he wants to address the board regarding item 2A, which is the discussion action on the Douglas Unified School number 27 mask mandate. So, Mark, you've got 3 minutes.
Good evening, ladies and gentlemen of the board. My name is Mark Wilkinson. I'm a resident of Douglas. I'm a father of 3. All my children have attended school here in the district. All my children are cursed with allergies, as myself. It's hard enough for us to breathe when our allergies act up, let alone with face coverings. The Delta variant is much more contagious, but a lot less lethal than the regular virus. According to the CDC, a total of 335 children ages 17 and under have died from COVID since the start of the pandemic. In the same 18-month period, a total of 49,725 children ages 0 to 17 have died from all other causes. That calculates to 0.673% of kids under the age of 17, as per the death certificate submitted to the National Center for Health Statistics. Most children that contract the virus don't show any symptoms. If they do, they're very mild. Out of those 335 deaths, we don't know how many had underlying conditions because the CDC did not publish that information. On April 19th, 2021, Governor Ducey, like it was discussed, he passed through Executive Order 2021-10, rescinded the Executive Order 2020-51, stripping away school districts and charter schools the authority to develop and impose policy mandating face coverings. We keep being told that we have to follow the science. What science are they talking about? As I recall, Dr. Fauci at the beginning of this pandemic said that masks weren't effective, that nobody should be wearing masks. He later said that only sick people should have a mask because of the droplets. Later on, changed his opinion again and said masks were really effective and everybody should be wearing one, whether inside or outside in public areas. What science do we believe? We forget that the best mask out there that they keep saying is most effective is a mask called the N95. The N95 has a filtration system and it has a 0.3 micron filter. Masks such as surgical masks and cloth coverings that are being worn tonight lack that filtration system and are much less effective than an N95. What about our eyes? The eyes are not just the window to the soul, as they say. They're like an open window for the virus. but nobody goes around with goggles, okay? St. Anthony the Great said, "A time is coming when man will go mad, and when they see someone who is not mad, they will attack him, saying, 'You are mad, and you are not like us.' That time, I believe, has arrived. I refuse to have my children have their oxygen rationed for the sole purpose of districts around the state to have their political theater." Thank you.
Thank you. Appreciate those comments. And members of the board, since he addressed a stir in the item, we can discuss exactly what he said if you want to. That's completely different from call to the public. So if you have any reaction to what he said, you can discuss it with him, or if he has any further questions, we'll allow him to do that, because obviously we're not going to have, that's the only one we have that wants to address the board. So, Jan left, so when she comes back.
She's coming back.
Okay. Do any of the boards want to make any remarks or comment or any reactions to what Mr. Wilkinson said?
Thank you, Mr. President. Mr. Wilkinson, I really appreciate all your points, and they're well taken. Things always change, and I think you alluded to that. As the science develops, the opinions change. And so I can agree with what you're saying, but what do we do in the meantime for the best? And I think that's our task tonight, is just think of what's going to be the best for everyone involved. And even one person getting sick and going to the hospital is too many, I think. Thank you.
You can go ahead and react to that if you want to. I mean, we've got time. We don't want to take a lot of time, but that's why we had the meeting at 5, because we welcomed and would hope that we would have had more parents here to express their opinion. So go ahead if you want to react to that.
Thank you, sir. Yes, we're saying that they're telling us that science and studies evolve, but those numbers that I gave you, as far as the filtration system, numbers and math are constant. That's not going to change. Biology isn't going to change the size of the particles of the virus versus the filtration systems that are in use. We keep talking about the number of people who are positive, test positive, the number of cases, but have you noticed that they don't have a death count anymore? Because it's a lot less lethal. The variant is a lot less lethal than the original virus. We don't hardly hear anything about flu anymore, because maybe it's not being counted. Maybe it's being counted as coronavirus.
Thank you very much. All right, any other members of the board, any reaction to that? And we do have the time, so,
I just
All right.
wanted to mention,
Mr. Ramos.
yes, thank you for coming, and I just wanted to say that my understanding is wearing a mask is not to protect yourself, but to protect the persons around you. Because you're going to hold in, if you're infected, everything should go to the mask and not out in the open. And second, I too have asthma, and I have nasal congestion, and I have to take medication for both. But my mask, I couldn't use something like that. I have to use something here where I have a little bit of breathing room, so I can have that amount of oxygen, especially when I'm walking. I'm going to need more. So I try to handle it the best I can, and also when I'm not around other people that I'm at a safe distance, I remove my mask because I need to breathe. But that's just a point that I wanted to make, that the masks are not to protect you, but to protect the people that are around you. And that's my point.
Mr. President.
Okay, thank you again, Mark, for being here. Appreciate your input. And now, members of the board will deliberate, and we'll open it up for discussion regarding the item as presented by, were you here when she, yes, you were.
Yes, I was.
And what we're specifically going to be addressing in the resolution. So we'll open it up for discussion. Go ahead, Ms. Elsa.
This is hard. We just lost 2 children in our district, and I think about, even if we had one child who became ill and we lost them too, what voting against a mask mandate, I would feel really responsible. And I think I came on the board because of my love and dedication for these children. And I feel like we have to do everything we can not to just provide the best education possible, but a safe setting inside the school. And those are my concerns.
Okay,
What do you mean by we lost 2 children?
We lost 2 children in an accident.
Oh,
And,
okay,
and
I
that's
thought you were related
devastating.
to this. No.
But no, not with this, but still, it kind of opens we all know that that's possible. And they're not directly related, no. But that's always in the back of your mind when you're making a decision based on health, is that who does this ultimately affect? And that's how I feel.
okay, thank you. Mr. Lindeman, did you have any remarks you want to?
Thank you, Mr. President. I see reports from Dr. Miller, and I hear the reports on the CDC side and everything, and they're saying that wearing a mask is one of the first things that you can do to mitigate any of the transmission of the virus, and we're doing that, and I'm hopefully we can keep that up. Also, it's a distancing. You see, we're distanced up here again. You're not supposed to go to crowded places, and you have to continue with these things. And I think that we have to continue, and not only that, but everybody that is eligible to be vaccinated should be. And if we're ever going to nip this in the bud, everybody has to be doing everything they can. And that's my opinion. And of course, then now we're going to have booster shots. Well, November is coming up for me. I feel like a pincushion anyway, but so I'm going to do it. And I think that we have to continue to do everything we can. And the caveat to that is that when you're outside, then you can have a little bit of a reprieve. And I really want to make sure that we are protecting those that cannot get vaccinated, the 12 and younger, so right now. So that's the consideration too. Mr.
Thank you.
President.
Dr. Gomez.
I wanted to prepare myself, so I went on Google and I typed in, what do the masks do? And there was 2 articles that I really read, and one was certainly for the use of masks. The other one was talking about the situations that you go through with using a mask. Mario, I'm sorry, but when you say you give yourself room for air, the mask is not working for you. It's not working for the people around you because it's coming out, if that's what you're using it for. Now, the other thing is that when you use a mask and it gets dirty, you're supposed to take it off, okay? And if you touch your face, if you touch the mask, then it's contaminated. So the best thing they said, sure, masks will work, but it's washing your hands and having a little bit of distance. Now, if you're going to be at the high school and you're going to be wearing a mask, you're not going to be distancing yourself from that person. You're going to be right together, okay? And the thing of it is that when you're close, then the mask may or may not work, okay? Protecting yourself or protecting from others. So that's what I found out, that there are some big misgivings about the mask. Because if you're going to mandate a mask, you have to make sure that you have the right protocols and the right information for the people that are wearing the mask. And so that, and then it went on to say, if you're wearing a mask, that might make you feel more comfortable so that you forget about the other things that go hand in hand with, you know, protecting against the spread of the virus. So that's my thought, you know, that there's a lot more to wearing a mask than just saying, we're going to do a mask mandate. Because if you're going to put a mask mandate on little kids, then you have to watch them. That, you know, that they're not touching their mask, they're not touching their face, and we have plenty of this, or washing our hands, you know, when they go into the classroom, and maybe during the day. So if we decide that that's what we want to do, then I think that we need to do it the correct way.
Very good, thank you, thank you. Mr. Ramos,
No, go ahead.
you don't have any comments you want to make? Before we get into a different aspect, do you have anything you wanted to add, Ms. Samaniego?
No, and we do know, I, just like Dr. Ed and Mr. Lindeman and everyone in here, I've done extensive reading, and this is a tough situation. I have many parents right now demanding that we enforce masks, that you're not protecting our kids. You don't have an online option. Why don't you have an online option? I'm not going to send my child to school. If you don't do this, I'm going to withdraw them. And then there's, you know, a handful saying, if you do this, I'm going to withdraw my children. So it's a very difficult situation. We're in a position, like Mrs. Selcha said, where we're not only in charge of the education of our kids, but we have to provide a safe and environment right now. And what is that safe environment? To the best of our ability would be to social distance 3 feet. However, I'm going to be very honest, some of our class sizes are large. Our classrooms in our schools are not built to allow for social distancing with all kids back. So that is unfortunately something that not most schools, or not every classroom even within a school setting, will be able to do. Some classes, some schools have less students, but even the schools that are maxed to capacity, we don't have any extra rooms to be able to split the classroom up and hire a different teacher. So the social distancing is a concern, and all CDC guidelines say their recommendations. If you're able to distance in a bus, you can go ahead and do it. If you're able to social distance in, or I don't want to call it social distance, I say physical distancing in a classroom, then we will. We were able to do all of that the last school year because a lot of students stayed home during an online setting. The situation has changed for us, and I want to be clear that the online option, it's not that DUSD doesn't want to implement it or didn't plan for it. It's that that authority wasn't given to us from the get-go. Our schools have to be open for in-person learning. So we are working currently on a new House bill that was just passed over the summer. But for some reason, the Arizona Department of Education and the state legislature and state board are not really communicating as much as they should. So the information for school districts to implement some type of a remote learning option, not for the entire school year, but in emergency purposes for situations like you have to quarantine, you have to send a whole classroom, you will allow, during the winter months, for kids to stay home and quarantine. That piece of information was just shared with us by AD last week instead of, let's say, in June, so that we could have been prepared. So I'm committed to working with my team in establishing a possibility of some remote learning options, not for the entire school year where you will have a choice to stay for the entire school year at home. Because of what we saw this past year, we lost a lot of students because they didn't have support systems at home. They didn't have somebody to make sure they were logging in and doing their assignments. So right now we have all of our students back. Our classrooms are full, and it is a parent choice right now. And you will see at the elementary schools many students wearing them and many students not. Some teachers are wearing them and some teachers are not. So going back to the proper use of mask, we continue to say exactly, it's a proper use of mask. We need to implement that, because if we're going to wear them, then let's wear them. This resolution, of course, would only allow us to implement the mask mandate through September 28th. Once the law becomes, we're going to follow the law, right? So the N95, as Mark said, that was shared with us today by the doctor that we met with today. It is a 95% rate of proper effectiveness. The surgical paper, which is this one, is a 55%. The multi-layer mask is 38, and a handkerchief, which you've seen people wear, or maybe the gaiters, are only a 2 to 13% effectiveness. So there is a variation of even the kinds of mask, and that's where we are today. But we're representing all children, and we have an obligation, and that obligation maybe right now is to go in this direction at least through the September 28th. We are seeing some cases in our schools, and fortunately, yes, we haven't heard from our parents that kids are getting extremely sick, but it is a concern. What if there's that one chance, one student? And we may be faced with that, even after September 28th, and that is a risk.
Okay, just to make sure we cover everything, there's been a lot of conversation going around the state regarding what the governor will do to districts that do implement the mask mandate. And as I was mentioning to a couple of fellow board members here, in order for the governor to enact something like that, it's going to take about 3 or 4 layers of state government before that would ever come into effect. It would have to go through the state treasurer. The State Board of Education would have to have the onus put on them as well to see whether or not they would require the Department of Education to distribute those funds. So there's a lot that has to be done. He can say he's going to do that, but it wouldn't happen immediately. So those things are there. So the reason I mention that is because there is that fear
Concern.
that we'd be losing funding, but this district has got so much money that Mr. Soto has been so effective in. No, but seriously, we do need to consider that. But we're safe, if we do implement it, we're safe because of all of the legalities that she mentioned there and the protections that we have by the precedent of the court judgment. So is there any more discussion?
And I just, this would be indoors. As long as we're indoors, we'd have to follow the mandate. And outside, kids, which we didn't have before. The first mandate, we had to wear our mask even outdoors, and that was a problem. Kids do need to breathe, and especially be able to get some oxygen. And if they're outside, that is a CDC recommendation. As long as you're indoors, right now in schools, that's what the recommendation is.
Okay, so if I entertain a motion to adopt the mandate as presented, as you presented it there with the exact language, but the effective date would be tomorrow?
Tomorrow through the September 28th.
Is that enough time to give parents notification?
We're ready. And, I mean, we're going to give leeway tomorrow. If kids don't bring a mask, we're going to have one provided, but we're going to send if the board approves, we will send communication out right after this meeting.
Okay, before I ask for the motion, does the board want her to give a brief synopsis of what that's about again, or do you have it?
No, I haven't.
I'm talking to board members.
Oh.
Or do you want her to give a brief recap synopsis of what it is, or are we ready to go with it?
But I have a question.
Dr. Gomez.
You were talking about that was done by the attorneys? What is
Uh-huh.
it?
The trust.
Okay, so who asked him to do that?
I contacted them to see if we could, at any point, implement a mask mandate. I mean, I'm not going to bring something to the board that we're violating the law. And last week, it was, we would be in violation of the law, but until there was a court ruling, we have to wait and see what this court ruling is on the other school districts that started implementing that. So when that court ruling happened, and that's in your background information.
No, that's fine.
Yeah,
But
and so-
because the reason I'm saying this
Uh-huh.
is because it has some language in there that I'm not too comfortable with.
Okay.
I'm not talking that if we decide to go with a mask mandate, that's fine. But the thing of it is that it says there's something about, I forgot what it was about the middle. something
Let
up
me see.
there.
Whereas the Arizona Constitution provides any legislation passed by the legislature, no?
A little bit up above.
Up above? Whereas the health department lists the universal and correct use of masks as one of the 5 key mitigation. Whereas the governing board has the authority to establish policies and procedures for the district to help ensure student safety. The affirmative vote, maybe that section, was it, no?
No, in other words, what it was like to me was like saying, okay, we're drawing this thing and this is what we're going to do. And like there was no discussion, no changing. It was already like a done deal. That's the way I got it.
Oh, okay. So the resolution is, and I asked the attorney, we can go, I said, can the board just say, we're going to approve a mask mandate through September 28th? She says, yes. We have a resolution that some districts have gone with, and you could present to the board, which basically establishes the same thing through September 28th that the board could adopt. So it could be either or. If you don't want to approve a resolution, but approve a mask mandate, this is just something that districts are using.
Okay, and then, of course, also, we know that Arizona School Boards Association is promulgating a mandate as well, and that they're
Yeah, they're working
highly
on some-
supporting and encouraging school districts to do it. Now, but that's another question. Yeah, but so, if we're ready for the motion as presented, the language as presented by the superintendent, I'm open for a motion.
Mr. President, I move that we accept the motion as presented.
Is there a second?
Second.
By Mr. Ramos. Any further discussion?
Sierra Vista has gone back to a mask mandate, and it's good for them because they are one of the lower ones that are vaccinated. And as far as I'm concerned, I said that again, the key to this is that everyone who's eligible should get the vaccine. And then they're going to work on, I read where the younger children, 12 and under, are going to have a vaccine available sometime in January, possibly midwinter. So let's all hope for the best. That's it. Thank you.
Okay, any further discussion?
I just wanted to say that I know we're gonna find a solution medically with our vaccines to eliminate this COVID. But in the meantime, I wanna see that our children are safe. Whatever we can give them at this time, and using the mask is one of the principles that they want us to use. And the biggest issue is, God forbid, that a child could die from COVID because we didn't do something about it. I don't want to be responsible for something like that.
Very good.
Can I just say?
Sure, absolutely. Yeah.
Because that's been mentioned. Jana, you mentioned it, and now Mr. Ramos. What is the chances of a child in elementary school getting COVID and dying? I think Mr. Wilkinson did the figures, okay? And yet, we had 2 children die in an accident.
Yes,
Okay? How could we have prevented that accident?
we couldn't have.
We couldn't have. We had 3 children die in the flooding in Agua Prieta. Again, what difference would a mask have made to them? So the thing of it is, you can't go on fear and say, oh,
True.
God forbid. Well, yes, God forbid. Absolutely. But God forbid that I should have a heart attack right here. I hope that Ray knows how to do mouth to mouth. And so. you know,
Preferably, Jana.
we have to think about those things. And if we're gonna do the mask mandate, well,
And that's what I do encourage parents, as I've been receiving emails, because some parents are more fearful and some parents are less. And our job is to say, we can't prevent, right? There's not a mask, not a 3 feet distance apart. for me to prove or say that a child won't contract the virus, and hopefully they will have mild symptoms, get better in 10 days, and be back in school. So that is true. I mean, we lost those kids, and unfortunately, and then we have a lot of parents saying, please do this, at least protect my child.
I do have a little question, though,
Go
for
ahead.
Anna, and anyone else who can answer. Do we see parents sending their children to school when they know that they're sick? Does it seem that way? Do they end up in the nurse's office?
Yes.
Do children, yes?
Yes.
Okay, and I saw that as an educator. I saw that, you would wonder, how could they come to school? They're so sick. They've got a high fever. They're coughing. They're sick. And the one thing that when I asked the nurses, how often do we see this? It was often, because maybe the parents had to work that day. Maybe the parents didn't have adequate health care, and this is not anything about health care, but they knew that the district had somebody in the school that was trained to identify whether a child was truly sick or whether it was allergies or something like that. And they would send these children to school. I mean, when the flu season came up, I know how many days I took because I was exposed by children in my class, in my classes. And that's what I wonder is, how many last year when we came back to school, and even before we went to the online school, a year and a half ago, 2 years ago, how many parents were sending their kids to school? And is this starting to happen now?
Yes, and I don't have a number for you, but I do know it's happening even as we speak.
Okay.
Okay, before.
Mr. President,
Go ahead, Ed.
I'd like to say also that the children are susceptible, and it's getting worse. If you look at the statistics from Florida, for example, they're having a major outbreak, and it is getting to the younger children, and so we go back to one is too many, but it can happen, and it is happening. So that's what I want to say.
Okay, hopefully, as always, that we always do the right thing in the best interest
It's
of
hard.
everybody in the district. And
One more thing, Mr. Mayor. And then we also have to remember that we have that option for the parents. If the parents want them to wear a mask, by all means, do it. I got a letter from a person that had his child in elementary school that said, if you're going to ask for a mandate, of course, I don't know where he was going to send it, but she says, I'm going to take my child out of the DUSD because I don't want her wearing a mask. So,
well, I heard that twice today myself, but those are decisions that parents are going to have to individually make on their own, independent of whatever the school district does. Any further discussion? I want to completely cover this as thoroughly as possible. No more discussion, Mr. Ramos? Anything else by the administration? Thank the administration. Thank you, Anna, for all the background work you've done and all the agony you've gone through regarding this issue. And want to thank the staff for being here that participated tonight and helping us go through this meeting. And unfortunately, Mr. Wilkinson was the only person here to address the board tonight. And it's always helpful for a board member, especially when you're representing children, to get the best information possible and in deliberating towards the final vote that you have the best information in it and you analyze it and in your mind the best you can, and hopefully you do the best in your vote. So with that, thank you, everybody. Roll call.
Ms. Selcha?
Yes.
Mr. Lindemann?
Yes.
Dr. Gomez?
read me the motion.
The motion was as the resolution is
Is the
read by.
resolution? No.
Mr. Ramos?
Yes.
Mr. Bering?
Yes, motion carries 4-1. Entertain a motion to adjourn
I move to adjourn.
by Mr., was it Linden or Ms. Salchow?
Linden.
Mr.
Linderman, second by
Salcho.
Ms. Salchow. All those in favor signify by saying aye.
Aye.